Before the name of COVID-19, the virus was called as 2019 novel coronavirus or 2019 nCoV. 2019 novel coronavirus means that the virus was new and began at the year 2019. On February 11, World Health Organization announced the new name for novel coronavirus, which it was officially named as COVID-19 or Coronavirus Disease 2019. According to the World Health Organization, the old name of COVID-19, which is 2019 novel coronavirus, could give confusion to other diseases because there are also illnesses that has acute respiratory disease. This is the Wuhan city, the capital of Hubei province in China, a major industrial and commercial city and home of over 11 million people. This is where the coronavirus disease 2019 or COVID-19 originated. In a wet market, it was suspected that the disease first spread, but not only seafood is sold in the market but also wild animals. This was believed to be the source of the disease transmitted to humans. According to the World Health Organization, the Department of Health as well as the American Center for Disease Order added that the possible source of the COVID-19 was due to illegally traded wildlife and animal meat in Wuhan, China, and it was believed that COVID-19 came from bats. It was first reported that there were an increasing number of cases of pneumonia in Wuhan, China in the last days of 2019, and it quickly spread to other cities including Beijing, Shanghai, Guangdong, Macau, and Hong Kong. January 8, the first confirmed case of COVID-19 infection was reported outside in China. A female tourist from Wuhan flew to Bangkok, Thailand with symptoms of pneumonia and was immediately quarantined. January 11, a man from Wuhan also returned to Japan and was confirmed to have COVID-19. On January 20, South Korea confirmed that COVID-19 had entered their country. The next day, January 21, the first case of COVID-19 infection was reported outside in Asia. A man fell ill at COVID-19 a few days after returning to America from Wuhan, China. On January 23, 3 other areas outside mainland China confirmed that COVID-19 had also entered Singapore, Vietnam, and Taiwan. Due to the fear that the COVID-19 will spread quickly with the departure and repatriation of millions of Chinese who will celebrate the Chinese New Year, many celebrations in China have been suspended. However, on the very day of the Chinese New Year, it was reported that there were confirmed diseases in Australia, France, Malaysia, and Nepal. And in January 26, it was reported that there are COVID-19 cases in Cambodia, Germany, Canada, Sri Lanka, and the United Arab Emirates. Meanwhile, Department of Health announced the confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25. After experiencing mild cough in January 30, the Department of Health confirmed the first case of COVID-19 in the Philippines.
Globally, COVID-19 has already affected 40.6 million individuals. However, 27.8 million of them has already recovered. Unfortunately, 1.12 million individuals were reported dead. According to the World Health Organization's statistics, the United States has the most number of COVID-19 cases in the whole world, with a total of 8.28 million individuals affected. Locally, COVID-19 cases in the Philippines has already reached 361,000 individuals affected, 311,000 recoveries, and 6,690 deaths. Top 5 cities in the Philippines with highest number of COVID-19 cases were Metro Manila, Calabarzon, Central Visayas, Central Luzon, and Western Visayas. Metro Manila has already reached 181,000 cases, 162,000 recoveries, and 3,167 deaths. Latest graph on COVID-19 cases here in the Philippines shows that the cases were slowly decreasing. Hopefully, it will continue and time will come that there will no COVID-19 left here in the Philippines.
When we hear the word COVID-19, what comes into our mind? Dangerous, an infectious disease, and can be fatal. According to World Health Organization,
COVID-19 or coronavirus disease 2019 is an infectious disease caused by a newly discovered coronavirus.
as what Yang Li, Sun, Zhao and Tang 2020 stated from their study entitled Focus on Characteristics of COVID-19 with a special reference to the impact of COVID-19 on the urogenital system. COVID-19 is a new infectious disease that first emerged in December 2019. Coronaviruses belong to the Coronavirus family in the nidovirus order. It is a crown-like spike virus, thus it was named corona. It contains a single-strand RNA as a nucleic material. WHO stated the virus is transmitted through droplets from an infected person, coughs, sneezes, or even exhales. Well, these droplets are too heavy to stay in the air and immediately fall on the floor or even on the surfaces. It is mainly characterized by high fever, cough, myalgia, and dyspnea. It causes progressive respiratory symptoms and severe diseases such as organ failure and death. COVID-19 is not a joke. It is why we are currently quarantined to avoid close contact with an infected person, thus preventing ourselves being infected.
So COVID-19 affects different people in different ways. So most of the infected people will develop a mild to moderate illness and recover without hospitalization. The most common symptoms of COVID-19 are fever, cough, and tiredness. So other symptoms that are less common and may affect the patients includes aches and pains, nasal congestion, headache, sore throat, diarrhea, loss of taste or smell, and a rash on skin or the discoloration of fingers or skin. So these symptoms are usually mild and begin gradually. So some people become infected but only have a very mild symptoms. So people with the mild symptoms who are otherwise healthy should manage their symptoms at home because according to World Health Organization that most people, about 80% of them recovered from the disease without needing hospital treatment. However, in terms of serious symptoms, it includes difficulty of breathing or shortness of breath, chest pains or pressure, and loss of speech or movement. So if you have or if you observe a serious symptoms, seek an immediate medical attention and always call before visiting your doctor or any medical facility. So what are the things we need to do if we feel unwell? So first thing we need to do is we must know the full range of symptoms of COVID-19. So what are the symptoms that I mentioned earlier are the things that we need to be aware of. Second is we must stay at home and self-isolate even if we feel a mild symptoms such as cough, headaches, or mild fever until you recover. So self-isolation is very important and call a healthcare provider or health hotline for advice and have someone to bring you supplies. So if you need to leave your house or have someone near you, wear always a medical mask to avoid infecting others. So the third thing you need to do if you feel unwell is if you experience fever, cough, or difficulty of breathing, you must seek medical attention immediately. It's either you call by the telephone or cell phone. It's either you call any hotline first if you can. And you need to follow the directions of your local health authorities. And the fourth and last thing you need to do if you feel unwell is keep up to date on the latest information from the trusted sources such as World Health Organization and other local and national health authorities. And local because local and national health authorities and public health units are the best place to advise on what people in our place or area should be doing to protect themselves. So COVID-19 affected our day-to-day life and is slowing down our global economy. And this pandemic has affected thousands of people who are either sick or are being killed due to the spread of this disease. COVID-19 has rapidly affected our day-to-day life, business, disrupted the world trade and movement. So identification of the diseases at an early stage is vital to control the spread of the virus because it very rapidly spreads from person to person. So during the midst of pandemic, most of the countries have slowed down their manufacturing of the products, and the various industries and sectors are affected by the cause of this disease. And this includes the pharmaceutical industry, the solar power sectors, the tourism, the information and the electronic industry. So indeed, this virus creates a significant knock-on effects on the day-to-day life of the citizens as well as to the global economy. Presently, the impacts of COVID-19 in our daily lives are extensive and have a far-reaching consequences, and these are divided into various categories, and one of the category includes the healthcare, and under the healthcare is the challenges in the diagnosis, quarantine, and treatment of suspected or confirmed cases. Second is the high burden of the functioning of the existing medical system is also under the healthcare, and also patients with other disease and health problems are getting neglected. And another one is the overload on doctors and healthcare professionals who are at a very high risk. Under the healthcare also are the lots of requirements that are required for high protection. And lastly, under the category of healthcare is the disruption of the medical supply chain. The other category that includes the impacts of COVID-19 is the economic. And under the economic is the slowing of the manufacturing of essential goods. So there are also a disruption of the supply chain of the products. And under the economic also is the losses in national and international businesses, and poor cash flow in the market also include in the economic category. And lastly, the significant slowing down in the revenue growth of the country. So the last category that affected by the COVID-19 is the social category, which it includes services or service sector is not being able to provide their proper service, and there are also a lot of cancellation or postponement of the large-scale sports and tournaments, and also there are also a disruption of celebration of cultural, religious, and festive events. And also we are required to have a social distancing with our peers and family members, and most dominantly is the closure of the places for entertainment such as movie and play theaters, sports, gymnasiums, and even parks. And lastly, the postponement of examinations.
Until today, there's still no vaccines and medicines for COVID-19. But even though there's still no cure for COVID-19, you can still avoid them by doing these easy steps. Wearing face mask will help because it will prevent the spread of the virus
and will protect you in any airborne infectious virus. Step 2. Always wash your hands. Keeping our hands clean is one of the most important steps to avoid getting sick or catching the COVID-19. Step 3. Stay at home. A simple yet a very important step. Stay home as much as you can. By doing this, you are just not protecting yourself but also protecting the others. Step 4. Observe social distancing. It is important to keep your distance at least 6 feet away. Step 5. Seek for professional help. If you notice that you got the symptoms and condition of COVID-19, please contact the nearest professional healthcare. Those are the easy steps that you can do to avoid the coronavirus. I hope that you learned something from this video.